So, Dr. Afrouz Demeri, my question is, how do our minds stop us from getting healthy?
It's a really good question. I'll back up and say that most of medicine has been so obsessed with molecules and cells. And even in school, we learn science, we learn biology, we go all the way to the atoms and the protons. And we don't really even realize that it's 50-50. Or I would say with the study of psychoneuroendocrinology or psychoneuroimmunology, which is what I studied my undergrad 5 years, was all in understanding the biology of our thoughts and our beliefs. And I studied the brain for 5 years. So I'm going to use the word mind and brain interchangeably because we don't realize that this is the most powerful organ we have. It starts developing 6 weeks old in the womb, and it's the first organ that develops. And it holds on to every single thing that happens to us from the womb all the way to now. So when you ask, how is the mind related to your health? I would say it's even more than 50% of the physiology because our thoughts and our mind is what dictates the neurochemicals to be released, the hormones to be released. Those are all just messengers. Those are all just saying, hey, we're in a good mood today, let's do this. Or, oh gosh, we're afraid. Let's make her afraid. Let's make her heart rate go up. We're tired. Let's make her sleepy. Let's make her feel a bit moody today or sad. So those are all messengers. And we think that's how it starts. But really, it's the other way around. We have it backwards in medicine. We're so not still up to date with research because we have been focused on the body too much, in my opinion. And I love that I studied medicine, but because of my background in biopsychology, I know the importance of the mind. The mind is everything because the brain holds on to every single emotion we have, positive and negative, but we tend to remember more of the negative ones and they add up, they have a cumulative effect. And then we start to see the symptoms show up. And I often say, if you haven't had an accident, if there wasn't trauma, let's say to your neck, or you weren't in a car accident, which caused the back to go off and then the pain started, every single symptom that you have has an emotional component because you're one person and the mind and the body are connected. We know that. When I was in school, there was still some debate of, they would teach us back in the days when we also used to think that the earth wasn't round, that the mind was separate from the body, right? And it was this entity outside of you, and that the brain was just physical and the mind was sort of, we didn't know where these thoughts came from. Now we know that they're connected. And I think we need to focus more on our emotions and our past and what things we are still holding on to that is subconscious. And I just want to remind everyone that your brain on a day-to-day operates at a 95% subconscious level. It's 5% conscious. So when you get up and you go brush your teeth, you make your coffee, you are not consciously thinking about those things. You've programmed things, but the scary part is the emotions are also programmed. So whatever has happened and occurred that you haven't healed, you're holding on to that and you're operating with that program now today, which could have happened when you were 6, when your sibling was born. And you were no longer the only person in the family. That could be emotionally traumatic for a child. I grew up in the war, so that had a huge emotional component around fear and losing someone you love. I had my first heartbreak when I was 12 in Australia, and I asked a guy out and I felt rejected and humiliated. My brain holds on to those things. But of course, we put it away and we live, and then we go to the doctor and we're focused on what do I have and how do I fix it? The Western world is so pill oriented that we want to fix it with a pill and we want to do it now. We want to do it quickly. But a lot of this is emotional. It's emotional things from our past that our brain is holding on to, which is causing the imbalances that you see today.
So, how do we deprogram? I know that's a big question, but you're saying all of this is programming. So how do we deprogram and then reprogram?
That's a great question. I wish I knew how to do it myself personally, but I'm learning it because I got to experience this through first figuring out what doesn't work. And what didn't work for me was talk therapy. So I did 10 years of just regular talking to a therapist, which was really important in first expressing yourself. But because you're conscious when you're talking and you're telling your story, and the therapist is also conscious, it didn't really reprogram. I felt great. And then I would go back and then something would trigger me. And then I'd be like right back into that same pattern, right? And I thought, wait, this doesn't really cure it. It didn't really help solve it. It helped me in the moment express myself and be heard and be seen, which is really important. But then I did cognitive behavioral therapy. I thought, okay, I tried every single style that there was, mainly because I was in this field and I was curious to see, okay, all these things I'm studying, there's good research behind it. What's going to help me? Until I stumbled upon EMDR, eye movement desensitization reprocessing. And I'd never heard of this. And I thought, why haven't I heard of this? I had heard of it only for vets that come back from the war and they have major PTSD, and they use this, with them with great success. So I'd seen the research on it, but I didn't know any friend of mine that went to an EMDR therapist to get reprogramming done. And I met this woman called Dr. Sarah. She has a PhD in EMDR therapy, and she developed her own technique where she is connecting the left and the right side of the brain, basically going deep into the limbic system where a lot of the stuff is stored. And it's like, how do you access that? And I don't want to go back. I don't want to relive the past traumas and talk about it, which I already did. And it wasn't fun. It's hard work. No wonder most people, don't really enjoy this process. It's not fun. And it was hard because you're crying, you're living it. And sometimes it's not enough the 1 hour you leave and life happens, especially if you have kids. And it's like, what do I do with this information? But what she does and what EMDR therapy is doing is reprogramming. And it is profound. I mean, I can't tell you how quickly it worked. But the way it works is you revisit the emotion, you go back to that trauma in a way, but you don't have to relive it. She doesn't care to hear the story. She doesn't need to hear what happened. You feel it in your body. Often she would have me, let's say someone goes in and they have a headache, or they have some neck tension, or they have some back pain, or they hold a lot of tension in their jaw, right? They have TMJ, or they feel nervous in their belly. You close your eyes and you just quickly can feel, what does it feel like? And you can see people will say, I feel tightness here. Okay, what does that feel like? I feel scared. I feel fear. I feel anger. They'll feel an emotion. And then she gets you to go back to the last time you felt that. And you keep going back and back and back. And you'll be amazed when your eyes are closed and you're on the subconscious, which is kind of like what people know as hypnosis, but this is not hypnosis at all. You're listening to certain sounds in your ear and things are vibrating in your hand. And so it's taking you back without you being consciously talking about it. And they just kept coming. I had no idea that subconsciously I was holding on to like this guy at 12, that I had felt humiliated. And that was sort of the beginning of me not feeling good enough, me feeling like I'm not pretty enough. I'm not like everyone else. I'm the outsider, being the only girl with brown hair in an Australian school. And so I had no idea why I was in relationship after relationship with men and feeling the same feelings of rejection every time they would leave. And then I'd blame the guys and think, why do I always attract these men? What's going on? Why do I always want to fix this? And I had no idea. So this is the one therapy that broke that cycle, because I got to see that I had identified with that emotion. And I almost had to prove to myself who I was, because that's who I believed I was. I wasn't good enough and I was the outsider, but I never knew how to erase that thought, because many of us have these beliefs, but we don't know what to do about it. And it's not enough just to say an affirmation of I'm good enough, I'm pretty enough, I'm this. That didn't work for me. It wasn't enough. It's a great starting point. But with Sarah's help and EMDR therapy, I can't tell you how powerful it was for me to understand how many of my physical symptoms were emotional and that they just naturally went away. I used to have a lot of shoulder and neck issues here on the right side, and I could tell it was stress related, but I never knew, like, why am I stressed? I feel great. Life's good. My job is good. My kids are great. My family life is great. There must be something deeper, but I couldn't tap into it myself. And so she was able to help me understand that things that happened in the womb, I remembered things that I never remembered consciously, but I felt my mother's sadness and I could feel it. And I was like, what is this? So the good thing is, because you're not so conscious, you don't keep doubting yourself. But when I did kind of come out of it, I was like, very skeptical. Like, I don't know if that was real. I don't know if that, and so the skepticism of the scientist in my head would kick in. And I realized I do that a lot in life. I overthink things. I overanalyze things. I analyze everything to death until there's like no intuition left. And I don't trust what I feel. What I feel, the left brain will come and say, no, that can't be right. That can't be proven. But it allowed me to kind of let go of that. And there was a lot of sadness. There was a lot of tears. I remember walking out of her office once, drenched. My sweater was so wet from tears. And I let go of a lot. And I would say that is the powerfulness in reprogramming, is erasing, deleting, and letting go, so that you can be present. So that when you do close your eyes and you meditate, you are fully here. There's nothing from the past that is still inside you controlling your thoughts. And so I hope that makes sense. I know for someone who's never tried it, it's a little like, what happens? How does it work? But there is a lot of research on EMDR therapy. So that's the only thing I know that works as fast as it does. In one session, it felt like 10 years of therapy for me. It was because we went to every event, and the biggest one was losing my dad tragically in an accident, which I had been holding on to. That one would trigger me right away. It would just be sobbing. And that one, I realized I didn't want to let go of that pain. I couldn't let it go. She gets you to put the emotion in a balloon when you're feeling it, when you're crying it. Give the color of the balloon. And I said purple. And she said, okay, now see the balloon in front of you. Go in front of it, and the sounds get louder and the vibration gets louder, and you can tell something is happening in the brain. It literally feels like a reprogramming. And she would say, pop the balloon. And the balloon kept moving. It was getting out of hand. I couldn't pop it. I couldn't let it go. And she's like, did you do it? And I'd say, I can't. The balloon keeps moving. And she's like, grab the balloon, tie it to a chair, go in front of it, pop it. I couldn't pop it. I didn't want to let my dad go or the pain of it go, because I had started identifying with that grief, with that loss. And I realized, wow, many of the things I couldn't pop, I was addicted to the pain. No one wants to hear that. No one wants to believe that. But I realized in that moment, when I was so raw with myself, that I was the reason I wasn't being as healthy and as happy. It was me. No one was forcing me to hold on to this stuff. I was holding on to them. And so it's not a self-blame at all, which I hear a lot of doctors, are very much against sort of the mind being at fault, because they don't want their patients to blame themselves. And it's not blaming. It's just being honest with yourself. It's just being real, that I'm afraid to let this go because I don't know who I'll be without this story, without this pain, I'm afraid if I let my pain of my dad go, then it means I'm letting him go and the memories go. So when I finally did pop it with her, I had to do 3 different things to be able to. I realized that day when I went home, I felt so raw. I felt like a little baby that was just fully exposed. And I didn't know who I was. I felt like I was starting all over again. And now I get to like rewrite, who do I want to be and how happy do I want to be? And I'm the one that's in charge of that happiness. And I finally felt like I got what everyone said in the books. I understood what it felt like to just be present, because I'd been trying and I'd sit and meditate and I couldn't. It's like the thoughts would come in and I was like, I'd rather be busy because it's easier. Because when I'm busy or dancing or working out at the gym, I'm not thinking, I'm fully present. But it was nice to finally be able to sit and just be and not have to focus on my breath, not have to focus on not thinking, not have to focus on anything, but just realize this is me, this is who I am. And without those past negative emotions, so much easier to be happy.
Wow. I'm so inspired by you, Afrouz, because there's a few points that really resonate with me. Sometimes we think mentally we're fine, right? Or if someone's going through a health issue, they're like, I'm doing all the right stuff. What's wrong with me? Or for me personally, it's like you said, I have a great life. I'm so passionate about my business. I have amazing friends and family, a wonderful husband. And even like going back to this weekend, I was kind of working a little bit. My mind was clear, but I felt the emotion in my chest. And I was like, where is this coming from? Why do I have a feeling of like overwhelm, sadness? And whenever I haven't done therapy properly, but I've talked to different belief coaches, and they've always asked me, what are you feeling? Or they try to go down to my childhood, and maybe my mind is too logical. I haven't spent enough time there, but I've never been able to get to the root cause of it. So just hearing your experience with EMDR, right? That was the right word, and really channeling into the emotions, because sometimes we're not aware. I feel like that's so powerful. So that's really amazing. Wow.
Yeah, you bring up also a really good point that I often tell my patients you could have the perfect life in terms of the best children, the best husband, a great successful career, everything outside, right? And you're still allowed to feel sad, and you're still allowed to feel tightness in your chest. You have to give yourself permission and allow yourself that grace to feel whatever it is that you feel. But in this society, we don't give people permission. We ask, why are you sad? Like Michael Phelps, like, how could he be stressed? And how could he be sad and depressed and suicidal? Like, he has it all. Or, all these stars, like, we don't allow them to just be human. And being human means you don't have to know. And that's the beauty of having kids, because it's such a reminder that half the time the kid doesn't know why they're crying. If you ask them why, they're like, they just feel it. And it's so beautiful to just feel and not have to answer a why question. I woke up the other day and I was really happy, and it was a Monday, and my friend texted me, how's it going? And I was like, I feel amazing. I was so happy. And she's like, why? What's happened? And I was like, nothing. It's just a Monday morning and I'm just really happy. And it just made me realize, like, we have to have a reason to feel what we feel. And that is sort of what's gotten us into trouble. We don't allow ourselves to just feel, and I think we don't until the body's like, okay, she's not listening to me. Let me put a tumor here, or let me make this muscle really tense and pull on the vertebra and make her have pain. And then she will pay attention, because she's forced to feel what I feel. And often in those moments when there's severe pain, my patients, I'll ask them, how do you feel? And they're like, I feel angry. I feel so frustrated with this pain. Right. Or I just want to cry is another common one. It just is making me want to cry because they're in a lot of pain. They don't realize that those are emotions that are stored in that body part. And so tightness is often, we have a better way of saying it, which is a prettier way, which is anxiety, or tightness, instead of, maybe I just feel a little uneasy. Maybe I feel worried. Maybe I'm, feeling a little scared. But my patients are like, no, I'm not afraid. I don't have any fears, or I don't feel uneasy. I don't feel overwhelmed. No, life is good, because they judge that to be bad, right? But if I say, well, according to this, you have an anxiety disorder, they're like, oh, okay, I thought so, you know. they're almost relieved to get that label, because there's pills for it, there's ways to fix it. But if you believe you have fear, that is overwhelming, and it's like, you can't go telling people, I'm afraid. That's weak. Imagine a man coming and saying they are sad, they feel really sad inside. We tell boys, you don't cry. You toughen up, you push through, you suck it up. You know, my son fell the other day from the tree and I could tell he wanted to cry. Right? My daughter cries, no problem. We're just like, ah, she's okay, you know. But I know he doesn't watch many men cry. And I know people have told him from their transgenerational, you know, beliefs from their dads and their dads that men don't cry. Come on, get up. You're tougher than that. You got this. So we've been taught at a very early age to not feel, and that what we feel, we should have a reason for it. So I also encourage you, good for you for owning that and just being like, I feel this. Good, feel it. Write about it, sit with it, cry it out if it feels like it needs to release. Often it's your intelligent body telling you, pay attention to me. That's it. It's for you and yourself. And so it's nice to kind of sometimes go in a bubble and just go in a room by yourself and journal or touch it. And often for me, it's amazing how I'll sometimes just start tearing. And I'm like, wow, where's, you know, and then as soon as my mind goes, where's that coming from? I go, shh, because the why questions are never good questions. Ask, how does it feel? Ask, what does it feel? Don't ask, why is it there? Because your left brain will come up with an amazing story, and we don't want more stories. We've created enough stories that most of them are not true and they're exaggerated. But ask, how does this feel? I asked my daughter when she had issues sleeping. She was around 6 or 7. We moved schools. We moved. Her dad and I had gone through a divorce. She was going through a hard time, but I didn't know because she's a pleaser and she just goes with the flow and is the first child, which is usually the very responsible child, doesn't want to be a burden to the family. And she wasn't sleeping. And one night she came out of her room and she said, Mommy, I can't fall asleep. I don't feel good. And, you know, 6 and 7-year-olds don't really know how to describe things, you know. And I said, what does it feel like? I don't know. And I said, okay, just put your hand on your chest. What does it feel like inside? Imagine I'm in your body. What would it feel like? And she closed her eyes and she said, it feels like everything is moving really fast inside. And I mean, as an adult, we would say that's anxiety, but that's not what it is. It's a sensation that she feels restless inside. Maybe it's from worry, maybe it's from whatever, but those are all assumptions. It's really important to get so in touch with yourself that you can just feel the sensation of what it feels like and not label yourself with something, because labeling leads to identifying. We tell a kid, you're so funny. What happens? They start being more carefree. We tell someone, oh, you're so angry. You're just like your dad. You know, you have your dad's temper. What happens? This was me. This is what people would tell me. The few times I would explode, oh, you're just like your dad. You have the angry trait. You're angry. And so what would happen? I had a very negative relationship with anger. And I hated when I would get angry. Instead of learning about my anger and what it was trying to tell me. And same, if you tell someone, oh, you're just sad, you know, depression runs in your family. Addiction runs in your family. They start identifying with it, just as they do when we tell these to kids. So it's so important to be careful with what words you think you have. I always say no one has anything. No one has cancer. No one has anxiety. You may be in a state and those states change. Just like if you don't do anything about your cancer in stage 1, it will go to stage 4 most likely. So things change. Just like if you feel anxious now or you feel worried, doesn't mean it's permanent for life. And I think that's what people are worried about, is that it's going to be forever and they have no control over it, right?
There's so much there that you said that I resonate with. First, thinking about the labels that we give children, and something that I'm being super mindful of, because I was labeled shy as a kid and I took that on for years, probably until maybe my 30s, labeling myself, I'm just shy. I'm just shy around people. I'm shy. And I was like, what does that even mean? And maybe was I just somebody who needed to take things in more, maybe needed to sit with what was happening? Maybe I wasn't shy. Maybe I felt more extroverted around certain people and more introverted around other people. So that resonates with me a lot, or being labeled sensitive or whatever it is. another thing that you said, this idea of, and I forget who said it, it's who are we without our stories? So asking that question, like, who am I without this story? And we all have our friend, and we've all maybe even been there, that it feels like something keeps happening to them. They feel like life keeps happening to them. One day they're something's going on with their neighbor, then their dog, then they're this, then they're that. And it's like, gosh, this person cannot catch a break. But this idea that are we subconsciously addicted to drama, addicted to pain, addicted to suffering because we feel like without all of that stuff, like we don't even know who we are. It's something I've been trying to unpack a lot lately for myself. Who am I without this story that I'm busy? My story is like, I'm a busy person. I'm just busy all the time. And it's like, what does that mean? Why do I need to hold on to that? And it's so powerful when we even ask ourselves, well, who am I without that label? So there's so much to say there, but I'm very fascinated. And I also just want to give you some acknowledgement for a second. How beautiful must it be for your patients to sit with you and hear from you, hear those really beautiful words come out of your mouth, and just have the opportunity for someone to even say, like, how does it feel inside, and walk them through this, because people don't ever really get that. So I just wanted to give you some acknowledgement, because I'm sure it's really profound, and I'm sure a lot of healing happens in that moment.
Thank you so much for that. I think I wish I could have been this kind of doctor when I first graduated. When I first graduated, I was very, very much into, preparing for my patients. What does the science say? What should I put them on? How do I treat this? And, the beauty of it is life happened to me. Death occurred. I had my daughter who had a lot of health conditions. There was another wound there. And so life happens to all of us. And that's why we can only plan so much. But things are going to go downhill. And that resiliency in that moment is so important, and the support of your own mind. And I didn't have that at that time. And I'm kind of glad, because it felt like I broke, even though I know I didn't. It felt like there was nothing else that could be worse to me. It was losing my dad and then my daughter. Anyone who has a kid, when you see them suffer and something's wrong with them, it's like there's nothing else that could. I was like, God, take it all. Like this is you messed with the wrong girl. You thought I could handle this. And that's when really the journey began for me to now walk the talk. Oh, you want to tell your patients to sit with their pain and not fight it? Well, let's see if you can do it. You want to tell your patients that it's okay if they miscarried, they can try again. Now let's see how you do with your first miscarriage. And so I think experience and life, I thank you for the credit, but really I didn't do anything. It's just I'm older and things happen to me just like all of us. And those are moments where you get to wake up. And when you're kind of slapped in the face and you're on the floor and you're just like, I can't even get up and I have to surrender because this is too painful. Those were my biggest lessons. And that's where it all came from, is really the guy who cheated on me and left me for another woman. It was the tragic losses, right? Because if it wasn't big enough, I feel like I wouldn't have changed. I was too smart. I was too in my head. It had to almost crack open my heart for me to like, oh, I can't breathe. I couldn't breathe because I cried so much when I lost my dad that I appreciated breathing for the first time, because I thought this is what people go through that have allergies and their sinuses are so congested that they can't breathe. Now I get it. Now I get it. And now I know what they're going through. So life teaches you, right? And I hope I don't have to keep learning and growing through pain. I hope I can learn to grow through love and happiness and joy. But if it ends up being the other way at times, I know I can do it. I know how strong I am now. And this is what I tell my women who have so much fear around speaking their truth. I can't tell you how many women on the retreats that come and that I see their biggest obstacle to their health is their mind, is not believing in themselves, is feeling so lost and disconnected from their own self that they think there's nothing in them that could help them, that they have to go to a doctor, that they have to go to some authority to fix them because there's something wrong with them. And often there's fear and shame in going back and admitting, you know, like a woman just told me, I'm not in a happy marriage. I've been married for 35 years. It's never been fulfilling, but hey, I'm miserable with him, but I think I'd be more miserable without him. So I'll just suck it up and this is my life, you know, and they will not bring it up. And so there's so much fear because we don't allow women to, like, it's okay to break. It's okay. You'll actually be surprised at how strong you are when that day comes. But we prefer to be in the familiar because, and that's the addiction to my pain that I had. At least it was familiar. At least I knew what it was like to have someone cheat on you and break up. And guess what? The next guy, same thing again and again. It happened 8 times for me to have to say, I am the common denominator in this, not them. Right? And so I don't want people to have to suffer. Suffering will happen, but it doesn't have to happen to the degree and intensity if we do our work. If we let go of our past traumas, the next one will be a 4 out of 10, a 5 out of 10, maybe a 9 out of 10, but it won't last weeks and months and years at the back of our mind. It doesn't get reprogrammed into that subconscious. And that's a great tool I learned from my therapist, is if something happens to you that triggers you, ask yourself, on a 10 being the worst intensity, 1 is it's not intense at all, where is it? And then how long does it last? If it's 30 minutes to an hour and it bothers you, it's on your mind, that's healthy. If it's more than 5 hours and it's more than a 6 out of 10, it's not about what just happened. There are other incidents from the past that have piled up in that wound, and this one just opened the scab. And so that has been so important for me, because sometimes something will happen and I'm like, okay, oh, I forgot about it the next day. Okay, that bothered me, but I understand that person. I understand why they did what they did. I'm not going to take it personally, right? To each their own. But there are some times where things don't let you sleep. You still feel tense and you don't even know, like, where's this coming from? Why is this bothering me? This shouldn't bother me. That's when you know it hit a wound. It's from the past and things that have happened with a familiar feeling. So ask yourself, is this a familiar feeling? Is the resentment I feel towards my husband the only time in my life I have felt resentment? Or is this a familiar feeling? For me, it was the rejection. I was like, this is for sure a familiar feeling. This is not the first time I felt it. I could tell you all the countless times. Well, did I heal those? I hope we learn to heal. And healing is letting go. Healing is so different than just pushing it aside and pushing it back there and trying to go, you know, get instant gratification from getting that promotion or getting that bigger house or a nicer car or that purse and feeling like, yes, this is what I want, right? No, those are instant gratification, externally validating you, and they don't last. Everything catches up with you. It will eventually catch up. An analogy I use with patients is, if you're 42 like I am, and you have 42 levels of a building and you're at the top of that 42nd floor, you want to look down and know there are no cracks on any of those levels. But if there's a crack that happened at 2 and 4 and 8 and 12, and these don't have to be huge cracks. It doesn't have to be a death in the family. It could be your dog got given away. It could be that there was a breakup, right? It could be simple. It could be the birth of a sibling. Those cracks eventually in that foundation catch up to you. And so do the work, because you want to be the happiest you are at the top, and know that, oh, I have a solid foundation and I'm present and I can't wait to 43, you know?
Gosh, I have so many thoughts that are going through my mind about this. There's two. One of them is what you said was really powerful about, and I was listening to Joe Dispenza and Jay Shetty. They just did a podcast, and I've listened to all of Joe's stuff, and every time I listen, something else hits me. So I highly recommend that for any of our listeners today. But he mentioned something that you said, where it's like, he was saying, I'm not telling people to not feel those thoughts. You're still going to have that feeling of, whether it's pain or overwhelm or frustration. The thing I like to say is, how long does that feeling last for you? Right? Because I think, to your point, and you also mentioned this, for me, I go into, why do I feel this way? What do I need to do? Do I need to have more balance? My mind starts going to solutions mode. But then if I take a step back and just feel, in 30, 40 minutes, I feel okay if I don't put that judgment. And I love that you mentioned that, because so many people might feel different things, whatever they're going through, and will judge themselves and just overthink it. But it's like, let's just work on feeling it and seeing how long it lasts, right? And I love that. And then the second point that stands out is, I just so appreciate you being so open and vulnerable about your own journey, talking about, it's so beautiful to see the type of doctor you were graduating from med school to what you're doing today. And when I was reviewing some of the old podcasts that you've talked about, there were so many life things that kind of positioned you to what you're doing today. And I know you mentioned, your daughter had health issues and you actually were in pediatrics. I didn't know that, but do you mind maybe sharing kind of your evolution from being in pediatrics to kind of what you are more recently kind of focusing on, or over the past few years?
Yes. First, I love that you mentioned Joe Dispenza, because that refractory period is sort of the term we use of how quickly you can get over the emotion and go back to peace. So it's really important. My husband and I always joke about this, because we're like, okay, that was good. That was only 20 minutes, or that was only 3 hours. And last time the refractory was like days. So you can bring humor into this and point each other out, oh, this refractory period's going to take forever. I do that a lot with him, and he just laughs, and that helps break it up, because laughing and smiling is such a great way to reprogram the brain. And it can be fake. Your brain doesn't know the difference. So we fake laugh all the time. And as soon as I start cracking up, everyone gives me the look. And that's one of the trainings I'm doing, is to learn to be silly, because I care so much about what people think from my childhood, having to always look good and try to fit in, that I was told you have to practice doing things in the middle of nowhere that actually, people are going to look at you and judge you, because you want this muscle to build, just like a bicep muscle, right? So your brain needs to keep working at things. It needs to develop and grow. Back to your question about how I got into what I do. There was 2 things I always said I'm never going to do, which was cancer and fertility, because to me, at that time, I was like, it's too sad. It's too heavy. I just don't want to do that. I want the patient who's constipated. I will have solutions for them. Easy, like gut health, hormones. And I loved kids. I always wanted to be a mom. Even I remember being 12, talking about 4 kids that I wanted to have, or 10 kids. I always was in mom mode. I always wanted to be the mom. When we played games with all the kids, I would fight over that role. You be the husband, you be the kid, I'm the mom. And so I was basically in what I termed trimester 0 from then, knowing that I want to be a mom one day. And because I loved kids, I went into pediatrics. My specialty was naturopathic pediatrics. So I saw a lot of kids. And then I realized the problems most of the time is not with the kids. It's the parents that I was calling in to come into the visits. And often there was hesitation. The dad wouldn't come. He was working, or the mom would say, can you give him something? He's not paying attention in school, or he's very angry, or I had a kid who had a hearing loss that the doctors couldn't figure out why. Everything was normal. And so I called in the parents, and I did a 1.5 hour intake. And I realized this kid, maybe psychologically, emotionally, is turning off his hearing because he doesn't want to hear all the fighting that's going on between the parents. And I thought, gosh, that is so crazy. I had the thought, but there's no way I was going to say that, because that wasn't very scientific. I couldn't prove it. I cared so much about what my colleagues thought back then, and what, again, same story of having to fit in. Don't be the crazy one that's woo-woo and out there, be a doctor. So I did all the other treatments, and we referred him to every ENT doctor there was, and he wasn't getting better. And so he went then and saw a homeopath who gave him a remedy, which is kind of mind-blowing still, that I didn't have the guts to go there. And that's because I hadn't done my work. I didn't believe in myself. I didn't believe in that intuitive voice that told me he doesn't want to hear for a reason. Anyways, his hearing loss completely reversed. The parents actually ended up getting divorced, but the fighting stopped. And then later, he came back to me when he was 18, and he told me he could remember, why. And he said right out that, yeah, it was too much. I would go hide under the table, and I would go like this all the time. And so that's another really amazing story, that the mind and your emotions impact you, they manifest physically. I mean, we know that now with placebo studies. It's been definitely shown that your mind affects you physically, for sure. We know that. But anyway, so when I had all these pediatric cases, I realized also that there's a lot we could have done during pregnancy. So then I went back and said, okay, let me go and treat pregnant moms. And so pregnancy became my new thing. And then I realized, well, the egg and the sperm have already met, and all their stuff is already there. It's almost too late, because I can't do a lot with a pregnant mom. I can't give her a lot of things. So most things are contraindicated. I also didn't want her to go through therapy, and they'd be like, we don't want to be crying and going through our stuff now. We want this to be a happy time. And I thought, okay, so I'm still in pregnant mode. Then I get pregnant, and I had Naya, and I didn't want to do any testing because honestly, I was young. I was 28. I didn't think anything would be wrong, and I said, whatever God wants me to have, I'll have. And when she was born, one of her eyes was sort of completely white, and I had a home birth in water, and it was just this beautiful birth experience. And as soon as I had her, I knew something was wrong. And everyone, again, dismissed me. So I've also learned again and again that what you feel isn't right. The midwife said, no, that's just the vernix from, the birth, that's in her eye. And I just knew. And this is the beauty of the intuitive mother. It's in all of us. Even the dad said, no, you're crazy. Like, don't be negative. Why are you thinking negative thoughts? I just knew. But again, I thought maybe they're right. And so we rushed to the hospital, and that's where all the hospital visits started. And so I was 3 months in the hospital. She had 7 surgeries in the first year of her life, and then ended up with another diagnosis. And so that was sort of my first depression episode, where I was crying almost every day. I didn't know how to handle it. It was just such a shock. But now I wish I could just go back and just hug myself and just say it's going to be the best thing ever. But I couldn't. I didn't even want to believe that then, and I wanted to drag everyone down with me in my pain. I was so upset with all my friends who were older, who had, there was this jealousy of like, how come they all have these beautiful kids and that are healthy, and I don't? And so I learned a lot about myself, that also misery attracts misery. I wanted to be around other people who were also down. And at that time, because it validated me. But when everyone was happy and all these baby showers, I didn't want to go. I didn't want to go to the park with all these cute, happy babies, because I was hiding her. I was ashamed. And again, all this was from my past. It wasn't the first time I had felt that. And so that's when I realized in the hospital, holding her after one of the surgeries, where they came out and said, we don't know if she's going to make it, because anesthesia, she was very small. She was 5.5 pounds when she was born. Anesthesia is very hard on a child and their liver, and sometimes things can go wrong. And so I was like, that's it. It's done. She's going to die, and I'm going to go too. So that was when I realized, and I looked around at Sick Kids Hospital in Toronto. There's a lot of sick kids, and there was a lot of kids who were blind. I'd never seen so many blind kids in my life, obviously, because I never had to go to the eye doctor. And I thought, wow, it's so interesting. And many of them were actually Indian. And I thought maybe it's just where we live in Toronto. And, talking to the doctors, there wasn't a lot of like Caucasians there. And I was like, interesting. And there were some Hispanics. And I wondered, like, why are all these people having blind kids? And then I'd go to the other section because she had heart issues. And then we'd see the heart people, and so many kids. And I thought, how can we have prevented this, or could we have? And at the time, we were buying a house, which had a lot of issues. And the two just came together of like, we did a home inspection. We did a termite inspection. We did a mold inspection. We did all these inspections. And I realized I never did an inspection on me. I never did an inspection on my husband. Forget husband. They didn't even ask about him. Like he wasn't even involved in any of the visits after when we were looking at, do you smoke? Do you do this? Did you do any drugs? Did you have any STDs? No one asked him if he had anything, if he smoked, if he was at all in good shape or good health, right? Did you take your prenatals? I was on such high folic acid, which is interesting because she has MTHFR, full gene mutation. So obviously she was not able to even break that down, but I didn't know about that stuff back then. It wasn't a thing. I just did whatever I was told to do, and I was very healthy. I never smoked. I never drank. And so I often wondered, like, could we have done something before we had gotten pregnant? And that's how the idea of Trimester Zero came about, because honestly, we were buying a house and I realized I would never just buy a house without looking at the house. I would go in there and look, and are there any cracks? What are we buying? How's the foundation? And I realized we don't do that. And everything epigenetically, the genes, everything is already made. So it's almost too late. Of course, it's not too late, but so much has already occurred. And even psychologically, consciously, like, why did I even want to have a kid? And what was that validating? For me, for sure, there was a component around that. And I was terrified to have another one because I wanted like 10 kids. But the thought of having another one was so scary that I thought, no, I can't. I'm not strong enough to go through because something could go wrong. And that's when I did a lot of work around fear and faith. And just the opposite of like, is this coming from a fearful place, these thoughts, or is it coming from a loving place? Because I want her to have a sibling. I wanted to have more kids. But so that's when I started digging into, I had mercury fillings. I had so much, there was mold in the house that I cleaned myself. I wasn't taking the right prenatals. My vitamin D wasn't optimal. My vitamin A wasn't optimal. My folate was low. I had started then cleaning up. I started detoxing and really taking out so many chemicals from receipts and pizza boxes and the jeans that I had bought that I never washed before I wore them. And I learned a lot because there was nobody back then that I could go visit and say, how do I prevent this not to happen again? Help me. Right. And so I had to kind of do my own work to kind of figure this out. And I did all that. And then I had Cyrus, my son, who by textbook is very healthy and was thriving. He was 9 pounds, so different. And actually it was your husband, Drew, that helped me realize that I'm doing a disservice to the world by not bringing this program that I had developed, because I was so afraid that one day my daughter would hear and feel bad that like, so it was my own guilt. I was so guilty that I didn't do this work before I had her, and I blamed myself. And he was like, are you kidding me? You need to share this with the world. Like, Naya would be so happy to know that this all started with her, and allow the world, be honest, be vulnerable, be yourself. And that's when I did that first podcast with him. And it was hard. It's hard to share my story. So I know what it's like when there's shame and guilt and blaming, especially as women. We blame when we take responsibility for everything. And it shouldn't have to be that way. Babies are made by two people, and it should really be both doing their work. When it comes to nutrition, when it comes to prenatals, when it comes to doing your conscious conception work, trauma work, all of it. Because guess who that baby sees the day they're born, even inside you, is dad. And we pick up so much from our fathers. So it's really important that both are doing their work, and it's not just all on the mom.
I love that. And I love Trimester Zero. Actually, everything that I've learned from you and then what I've learned from Ayurvedic and Chinese medicine, Trimester Zero is my favorite time of life, because it's like you're buying a home, like you use the home analogy, and you're decorating it and you're making it beautiful and you're cleaning it because you're going to live there. And so like when I reframed this idea of like, this is my baby's first home. My body is my baby's first home. Like, what do I want them to experience? How do I want them to live? What type of nutrients do I want them to have? Like, it can feel very, really scary going into pregnancy, but it can also be really joyful. And I think those ancient medicines teach us that a baby wants to come into a beautiful, thriving, joyful environment. And so when I personally take on that approach of like, how can I make my best body and mind ever for this baby to come into? Nothing is perfect. We can't be perfect, but we can do our best. It just makes it so much more of an exciting time. I'm now 36. I'll probably have next baby 37, hopefully, fingers crossed, 38 maybe. Yasmin is also thinking about baby two. We're going to be over the 35 hump. So for anyone who's listening to this, they're post 35, they want to have a baby. Is there specific advice that you have for them?
I mean, since we're talking about the mind and you said getting the mind and the body to be in the right place, actually, my first advice is look at yourself the way you are now and do a thorough assessment. What symptoms do you have? Because your symptoms will tell you what's off. So it's individualized. You could be 35 and a very happy 35-year-old healthy body with really good eggs, really good sperm too, right? We got to talk about him too. And you're doing great. But if you think that you're over 35 and now you're old because society says that that's geriatric, right? That term, it's like, of course that's going to have an effect, and you're going to believe that, and you're going to identify it, and your body will act like that. So first assess. I can't tell you how many people in my program are like in their 40s, and I'll check their progesterone levels post ovulation to see how the quality of the egg is. And I'm like, this is phenomenal. I'm jealous. It's way better than mine. You're okay in terms of egg quality. Or we do nutrients and we look at their folate, their vitamin D, their choline, all the nutrients, because those are important to the house, right? You want to make sure there's a bed, there's everything there that the baby needs, and that you have enough milk and all of that. And it looks good. You're good, right? But they're so anxious. They're so stressed. What if my friends, I had a woman recently said, my friends just had an autistic kid. I'm so stressed. I'm so worried because I'm over 35 and I read, and my husband has a schizophrenic, grandfather, and therefore, and they've already created the story. And I said, wow, that's a great affirmation. You've already created the affirmation. You keep saying that to yourself. It could happen, of course, but you do your best and do the mental emotional work. I think that's my biggest advice, and probably the one that people don't want to hear, because they're like, just tell me which prenatal to take. Just tell me how much CoQ10 to take. Just tell me, like, should I take progesterone before I get pregnant? Yeah, if it's low, take it. It could help prevent miscarriages. Check your clotting. Make sure your autoimmunity is in remission so that the body doesn't attack self, right? Make sure that your gut health is in optimal shape so that the baby gets those good bacteria from you. The most important system a baby needs to develop is the immune system, because that's where we're headed. All these kids with eczemas and allergies and cancer and autoimmune disease, it's all immunity. The immune system is so important, and the immune system comes from the microbiome in mom's gut, which is affected by your thoughts. The nervous system is in your gut. So the best you could do is kind of keep going backwards and go, okay, let's start with here. Let's make sure emotionally I'm the best place I can be. And then I can focus on the body and see, what symptoms do I have? Am I on medications? Do I want to be on these medications? Do these help the baby, right? Is dad on meds that have side effects? How's my mitochondrial health, right? So do I exercise and I get really tired quickly? Or have I had so many viruses that all my mitochondria are just so damaged that I'm really fatigued? Okay, what can we do to help the mitochondria, right? So you can take some CoQ10. There are things that actually help rebuild mitochondria, because they get all their mitochondria from the X chromosome. So it's important to really look at things from a very holistic perspective and not just think that, okay, I'm taking the right prenatal, I did my obstetric panel, I don't have syphilis, I don't smoke, I don't drink, I'm good, right? But also just have faith, just be open. Because if someone had told me back when I had my daughter that she's going to have this, you should abort, which is what they would have told me with Turner's, right? I am so glad for all the things that she has, because I wouldn't be here. I wouldn't be who I am today. I wouldn't be the kind of mother I am today. And so it's like, it's hard for me because I am a spiritual person and I don't push my faith on anyone, but I do believe that there is a greater power, more than me and you, that controls everything. So we can do the best we can, but we also just have to have faith and just go, I surrender. And whatever happens, I know I did my best. And that's what Trimester Zero is really about. And what you guys are doing to help balance hormones and make sure people are not in a progesterone deficit or estrogen dominant place, because it affects how you feel. And how you feel is the kind of mother you're going to be, and the kind of wife you're going to be, and the kind of person you're going to be for yourself. And so why not? Why not help the body? So I always say it's 50-50. You can't just focus on the body without looking at the mind, and you can't only do the mental emotional work, but be in a very nutritive, calorie deficit because you're not eating enough, you're not getting enough protein states, you're not exercising, you're not moving. You gotta have that balance between it all.
I love that.
I'm just gonna say, you guys don't worry about the numbers. The numbers mean nothing to me. I do like to look at lab values, and I will, be also very careful what I say to people, because let's say their equality is low and they're 38. I had a woman yesterday who I was like, okay, progesterone's very low. I don't even know if she ovulated. So I'm like, I don't know. This month you did not ovulate. So people need to know that if they're not ovulating, they're not going to get pregnant. So why are you not ovulating? Okay, well, you're traveling a lot for work. And is this home ready? Are you even ready to receive a baby? How are you giving the message to the child that I'm ready, right? You're not ready. You're going to Bahamas 2 weeks and then you're in Europe for 2 weeks. So your body is like, sex hormones right now? No, thank you. And she said, her libido is very low. And I was like, yeah, your body doesn't want you to be attracted to your husband right now, because it's like, nope, we're not having baby. We're not ready. So there's always mental, emotional reasons why things go low, right? If cortisol is like flatlined and the adrenals are so burnt out, like in her case, I said, you're not ready for a child because your body's telling me I'm exhausted. And you think a baby's going to help? You're going to get no sleep at the beginning. And it's a very stressful event for a female to be pregnant. It is the most stressful event of their life. Pregnancy is no joke. It is a lot of work on the body, and we get very depleted at the end of it. So for you having a second, I always say, make sure you rejuvenate. You fill up that cup on all levels. And also you mentally, emotionally have, if you can, just have a little talk with the first one to say that, my love for you is not going to go down. If anything, there'll just be more love to share. I did that, and I think it really helped me, because I was like, how can I have another child? I love this one so much. I don't want to have to share that attention and that love. But I realized it ended up just being quadruple the amount,
Our heart can grow to infinite sizes.
This is just interesting. The way, Kea, you talk about how you love Trimester Zero, and just hearing all your thoughts of Afrouz. And Kea, you mentioned this in another interview we did, but it's like, even for someone who's not looking to have a baby, everything that we're talking about is so powerful, because it's all about like, how do you feel? Is your health in the right place? Are you showing up to be the best person you can be? So I just want to reiterate that, because I feel like everything that you guys are saying is just so applicable to even women who aren't necessarily wanting to get pregnant anytime soon, or maybe don't want kids.
Yeah. It's not just your baby's home, it's also your home. So it's like, for me, it's the motivation, because I always am like, how can I help someone else versus help myself? So the motivation for me is like, oh, this is for a child. Like, I will do this for this child. But for other people, their motivation might be, okay, I need to do this for myself. So whatever it is. I mean, we should want to do it for ourselves anyway, but I'm just being real.
That's so motherly of you. That's the yin, right? And that's so beautiful to acknowledge and love that part of you that is very nurturing and giving. I would say it's same thing. It's the two coins, and you're just looking at that one side, but it's fine to also be the other, as long as it's not over giving and overextending. And that's what I see a lot of females do, is they overwork, they overextend themselves. that busyness, right? Their validation is coming so much from wanting to be successful. And for fertility, it is so important to balance that yang energy or the summer energy, right? The endless summer, which women love. Typically, it's like the, longer days, and they're outside and they're doing more, they're active more. The winter is so important also. The cold, the uncomfortableness, the difficultness of the winter, the having to make warm soups, and those are so important to also nurture in us before pregnancy, because we also don't want to teach our kids that the females need to be the way they are nowadays, right? And I know this is part of your podcast, the CEOs, and I always feel like, okay, you don't have to be like that. You don't have to be like that. You just be you, right? You just be you and take care of your emotional health is what I would love to to end with, because I guarantee you every single symptom you have has an emotional component. And I saw a man yesterday with shoulder blade issues and just so much tension. And, we went deep and we got to like, yeah, that's where he's holding his stress and his anger. Right. And we have so many people I see who come to see me for TMJ. TMJ, unless there's been trauma, is 100% emotions and holding a lot of tension, fear, anxiety, anger here, which is why it comes out sometimes at night when we have to kind of let go. It's like the body's like, okay, I've been holding on to this all day. This is when I'm gonna let it out, right? And then it gets very tight, and they wake up with that headache and just everything tight. What else? Tightness in the chest. We hold a lot of fear in our bellies, in our stomach. I have women who've been sexually abused. A lot of trauma has occurred in the pelvic region. We see that coming out in weak bladders, that they'll have to like urinate every hour when there's not even enough urine. So the body holds so much. What's another one? Restless legs, nervousness in our legs, right? Like we actually know this in medicine. We call it restless leg syndrome. Why are the legs restless? So we have so many terms in medicine that actually tell you the pathology and where it's coming from, and it's here. But it's so funny that doctors usually just want to suppress and kind of numb very quickly the symptom, and not realizing and telling the patient that this isn't really getting rid of your high blood pressure, right? The word pressure. Where's the pressure coming from in life? It didn't get rid of it. We just numbed it. And guess what? If I take you off it, it's going to go back up again. So did I really get rid of it? Did I really fix it? I didn't fix anything. I just put a big Band-Aid on, and I can't see it right now because it's covered. Right. So it's important to use medicine. It's important to use medications, I should say. The Michael Phillips can swim really well. But if he's in the ocean and it's stormy, he's going to need a life jacket, no matter how good of a swimmer you are. And that's when we should use medication, is in those moments. And it's temporary. But he's not going to need it if he's in the pool, right? And we shouldn't either. So there are moments in life where it's just too much. And there's life and death even, like there's sepsis. Use the antibiotics. That's okay. Right? And I tell my patients, it's okay, use the meds, but maybe just know that we're testing and seeing, does this help? Maybe it's just using it as trial and error to see if this is the cause. And then don't get addicted to it. Don't take it for life. Don't think that that's what you need, and if you do, it's okay. But it's just that awareness. I'm the kind of doctor that likes to just bring awareness because that's my personality, right? But there's different doctors that are not like me. They don't have the same beliefs. They haven't gone through life the way I have. So that's how they practice. That's why I don't call myself just a naturopathic doctor, because we're all so different depending on what we've been through and what our beliefs are, right? So I'm just me. This is my philosophy. And in 20 years, I might be way more easygoing, and just telling you to go walk barefoot in the ocean in the grass. I don't know. I might be that hippie doctor one day. I don't know. But all I know is the less I actually do, the better. And the less I try to help patients by giving them things, sometimes I do more harm, because I'm enabling them to continue in whatever they believed is wrong. And it's not the truth. Half the time I say, how many doctors have you seen? And they'll say, like, you're the 15th one. That's always a sign that I am not going to fix what you think I'm going to fix. Because what have you been looking for? Why hasn't anything worked? And sometimes I have to have that hard conversation and say, I'm not going to give you anything. Like, we need to do the inner work. We need to go inward. We need to do the harder work, because I don't want this to continue. I don't want there to be another doctor. No, it's not mold. No, it's not hypersensitivity to chemicals. There's a reason your immune system is reacting and overreacting to these things. Why? How come someone else will have the same and not overreact? So that's the deeper work. And sometimes people don't want that. They say, just give me something to take to make it go away. And I understand that. I've done that. And I will, but I usually leave with, just so you know, this isn't really getting to the root of it. And it's so freeing to get to the root and heal and completely understand yourself, understand why you are the way you are and where these things came from, and realize half of these things aren't even yours. They were passed on to us. They were from our childhood. They were from society. They were from the wrong messages we got from social media, which is happening a lot nowadays. Everyone is like, oh, I saw on Instagram, berberine is the new Ozempic, is a text message I got this morning from my patients. Afrouz Demeri, is this true? Can you prescribe me berberine? And I was like, no. I was like, if you want diarrhea tomorrow, sure. But this is the world's changing so fast. And we just have to be really careful in this Western pill, instant gratification, fast, quick. Let me lose weight now. Let me get things now, right? Even fast food is not fast enough. And that's why I love going on retreats, and even being here in Ojai and just going away from that world. We were just in Costa Rica for 10 days for a retreat, and I was very depressed when I got home, even though I love my home. But it's just the society is so different here. Everything, you sit there and it takes an hour and a half for even the waiter sometimes to come to you. When I was in Portugal, I was like, gosh, where is everyone? Why is no one taking my order? And they're like, this is just how it is. Just calm down, relax, breathe, look at the trees. It's so, so important to just slow down, because life goes by too fast, and we have to allow ourselves to be the happiest that we want to be. It's up to us.
Yes, so true.
So inspired by you, Afrouz. I feel like we could talk for hours, but we'll put all the information on your retreats, your programming, where they can find you in our show notes. But this was amazing. You are such an inspiration, and so appreciate you joining us today.
Thank you both.
Thank you.